Hi, my name is Grace. I'm a peer researcher for Young Hammersmith and Fulham.
Hi, my name is Fridas. I'm 17.
Hi, I'm Elaf. I'm 15 years old.
Hi, I'm Marley and I'm 18 years old.
We've lived in Hammersmith and Fulham for all our lives, and we really appreciate the wide range of diversity that we see every day.
The culture is rich. There's a wide range of youth services for young people to access.
But like every other borough in London, we understand that there are people who suffer with poor mental health who aren't seen.
And our research highlights this.
We decided to make mental health as a baseline of our project because we see how much it impacts young people around us.
Our key findings have led us to this one question: do external factors have a direct impact on poor mental health?
Over 50% of young people in our survey said that accessibility was an impacting factor in being able to access a youth club or service. However, when going into these youth clubs and asking young people about how easy it is to access a youth service, they contrasted this opinion and idea that we found in our research and said that it was pretty easy to access them.
One of our key findings was barriers. We found engaging with young people, barriers affected our responses as they didn't know what it meant. The top 3 barriers young people said was that they didn't know where they was, they didn't know how to get there, and they didn't want to go on their own. For young people to access these services, they need to have awareness and knowledge.
Over 33% of young people said they were very aware of what good mental health is. We also found that in our interviews, all of the young people knew what services were around, but they couldn't name any. Over 50% of young people said generational differences, cultural and religious views had an impact on whether they could speak to their family about their mental health or not.
Over 50% of people who answered our survey said that COVID-19 had an impact on their mental health. And when asked how much of an impact it had, over 42.5% of people said that it had a mild to severe impact on their mental health.
Another key finding was stigmas. 60% of young people said that they would feel embarrassed, and 42% said that they would feel judged talking about mental health.
67% of young people said they felt more comfortable to speak to their friend more than anyone else. 34% said they rarely speak to anyone about their thoughts and feelings. A young person in our focus group said, if you don't know the service, how can you trust the service?
Throughout all the interviews and podcasts, we found that young people think that schools need to do more in ensuring that young people are looked after during exam seasons because of exam stress. It was also found that young people think that schools need to do a better job of helping young people go through mental health crises and ensuring that they work with and collaborate with youth provisions to ensure young people know where to go when having a mental health crisis.
Over 50% of young people who took part in our research said that they did not know what mental health service to go to if they were experiencing challenges with their mental health. Young people who we interviewed said that they knew services in the borough but could not name any. When interviewing a mental health professional, they could not name a service other than the one they worked for.
Young people who have accessed a youth club or a youth provision said that it positively benefited their mental health by coming. They also said that they would recommend it to a friend of theirs. These are our recommendations which we think will improve access to youth provisions and mental health services.
We'd like the local authority to work in better partnership with school, youth provision and mental health services within the borough. We'd also like for there to be a better promotion of mental health services in the borough that are age-specific and appropriate.
We believe that schools and education systems should recognise exam stress and understand how it can impact on young people's mental health. And furthermore, provide better support and signposting for services to support if this is not offered within the school already. And we believe that they should join with local school services and do more partnership within local youth provisions and mental health services to ensure that students are getting the best offers available.
For mental health services, there needs to be more information about them available in places young people frequent, and there should be information for parents about how to support their young people with their mental health. For youth provisions, we think by allowing virtual or alternative sessions, this will create a better space for people who feel isolated and are anxious coming into new spaces. Having introduction to youth clubs or youth provision sessions, allowing new members to mingle and meet everyone to make it less stressful coming for the first time. Giving youth clubs better funding will allow staff members and spaces to be better suited for young people with mental health crises and allow a better, safer space. And by training youth workers to be mental health first aiders. This will reduce the waiting times on services like CAMS, which are necessary for mental health crises.
We also believe we should train young people to be peer mentors about mental health. We also should create safe spaces that they could talk about their mental health.
My name's Hannah, I'm the Membership Engagement Officer for the Young Hammersmith and Fulham Foundation. The Young Hammersmith and Fulham Foundation are a youth charity. We support the infrastructure of youth services within the borough of Hammersmith and Fulham, and our vision is to make Hammersmith and Fulham the best place in London to be a young person. And we do this by supporting our members through offering them networking opportunities, funding and training.